Well, good morning. Welcome to today's legislative listening session. Since this is a Zoom meeting, we ask that you keep yourselves muted until it's your turn on the agenda to speak. We do encourage questions, and you can type your questions by clicking the chat box in the lower part of your meeting window. This meeting is also being recorded, and a link will be provided to you after within about 2 business days. Thank you again for joining us today, and now I'd like to welcome Melanie.
Thanks, Mitch. Thanks for putting this together. Thank you all of you who were able to attend. We really appreciate it. For those of you who maybe don't know me, I'm Melanie McLennan. I'm the Director of Government Relations and General Counsel for WASAC. And this is the 5th of 8 webinars that we're doing. We did 3 last week, 1 yesterday, and we have 2 more tomorrow and then 1 after that. So we are staying plenty busy with these, and I think overall they've gone pretty well. We have a smaller group today, and so I'm hoping that that actually will lend itself to some really good opportunity for conversation. And I wanted to mention too, and because I skipped over it, you are welcome to join any of these calls that you would like. For legislators, we grouped these by region and by county rather than by legislative district. So there may be some overlap, and to see all of your counties, you may need to participate in more than one. But if you don't have time for that, we are also recording these. We are taking notes for these, and we are sending out that information, a copy of the PowerPoint, the notes, the video, all of that will go out to every legislator in those related districts, and we'll be compiling all of it at the end to share more broadly. So let me just give you a quick rundown on what our expectations are for the next roughly hour and a half. We will start with about 20 minutes of a situational overview from one of our hardworking local public health officials. We have Megan DeBolt from Walla Walla on with us today. Even though you may have more than one in your area, we decided to really only focus on one person for each region so that we weren't overwhelming people who are already working really hard and potentially already overwhelmed. So we really appreciate the willingness to volunteer. After that, we'll move on to about 25 minutes, about 5 minutes per county, to talk about the impact the pandemic and the county's response has had on county functions. So budget, operations, it can be anything from you had to go buy laptops so your staff could work at home, to you had to shut down your local solid waste drop off, to you're cutting staff because you don't have enough money coming in, whatever it happens to be. We want to hear how you're doing. And then we'll spend the next 25 minutes, again, approximately 5 minutes per county, talking about looking ahead. What do you expect will need attention going forward? What is scaring you? What's keeping you up at night? What things do you want to make sure legislators are thinking about as they potentially go into a special session, or next year when we go into regular session on, I said this yesterday, but I heard someone say your new rather than your new normal, because we don't really know what normal is anymore. So as you're anticipating your new, what are the types of things that you're thinking about and the types of things that your county is going to have to do to come out of this as successfully as possible, both economically and in terms of health. And then after that, we should have about 20 minutes for question and answer time. Like I said, since we have a smaller group, I think that will probably help facilitate that Q&A. And you are free to type into the chat box questions that you have. We'll take a look at those, and if it makes sense to ask them immediately, we'll do that. Otherwise, we'll save them till the end. But you'll also be able to unmute yourself and ask questions at the end as well. So why don't I then turn over the microphone to Jamie Bodden, our Managing Director for the Washington State Association of Local Public Health Officials. She can introduce Ms. DeBolt and kick us off. Thanks, Jamie.
Thank you, Melanie. And thank you all for joining on this lovely morning. Much appreciated to take the time away from what I know is a very, very busy and at times overwhelming response effort in your counties. For our legislative aides and legislators that are on the line, back when session was going on, you heard me talk often about COVID and coronavirus and the work that we were already doing back in January around responding to coronavirus. And the long hours that we were already putting in. Obviously, things have even evolved even more since then, and I'm just very, very proud of our local public health jurisdictions that are working very, very hard to respond to this. They've been on the front lines since January 20th when we had our first positive case in the state. It is my pleasure to introduce Megan DeBolt. She's the director for the Walla Walla County Health and Human Services Department, and she's going to provide some overview of kind of what has been happening in Walla Walla as well as the region. So without further ado, Megan, go ahead and take it away.
There we go. So just one thing, this was a voluntold role. Thanks, Jamie, for a call yesterday. No, I'm just joking. So I think here in Walla Walla, I would say, you know, when we first knew that COVID-19 was came stateside and we had a case in the Seattle area, you know, we immediately started planning with our healthcare partners at Providence. We are lucky here in Walla Walla that Providence is an Ebola assessment hospital. And so we already do a lot of what we call special pathogens preparedness work with them. And so we had just had actually an Ebola tabletop exercise, full-scale tabletop exercise in November. And so we worked through from when a case arrives and we are notified of somebody that has Ebola-like symptoms, to how they're tested, to how they're packaged, they're burrito wrapped and then sent to Spokane via, you know, secure transport. We worked through all of that just in November. And so we're really lucky, you know, as soon as I got the call on February 28th that we had an individual at the emergency room with coronavirus-like symptoms of fever, cough, shortness of breath, and pretty severe pneumonia. You know, we knew exactly what we needed to do. And, you know, in connecting with Department of Health to get specimen approved and then to be sent on to Department of Health for testing. And I'll just let you know that first case that we had, even though it wasn't even a Washington State resident, that's the joy of living. I mean, all of us within these 4 counties live in bordering Oregon or Idaho, and you know, is that we have to have kind of a multi-state, multi-county approach to a lot of this work. This one ended up actually including a, you know, the Confederated Tribes of the Umatilla Indian Reservation as well. And so, you know, when we first had this case, it was actually a Sunday where we had the testing done, and that's really tricky. And the reason I say that is because when that specimen's collected, you have to get it over to DOH really quickly to the Shoreline lab, because that was the only lab that had the capacity to test at that time. And so actually we drove it to Yakima, where then a Providence employee, their infection control nurse who was there for a basketball tournament, met us in Yakima and then took it on to the lab at Shoreline and dropped it off. And we got the test results back by the next morning. And then when we realized it was positive, it created a whole flurry of, oh, wow, this is real and it's here. But we're Walla Walla. Wait, we're over on the east side. Like we're hoping that we would maybe stay immune to COVID-19. But at the same time, we knew that wasn't realistic. And so we had the plans in place. We immediately activated our incident command. I serve as the incident commander for Wallace County Department of Community Health, which is a public health and human services And we immediately engaged with our emergency management and our healthcare system. We still participate in daily calls with Providence, so on and so forth. And so we were ready because the state had really helped us get ready. We'd already been having several epidemiology calls with the state and policy level calls with SALFO and DOH leadership teams to prepare us for this. And I think what helped make us prepared too is that we'd already been monitoring some travelers. And so we'd actually here monitored 8 travelers in Walla Walla County. And so travelers are individuals who had come off of cruise ships, or they had recently traveled back from China, South Korea, Italy. And we actually had a couple from Germany here that we ended up monitoring for symptoms as well. And so when we were notified that we had travelers coming back to our community by the Department of Health, we called them immediately. They understood their guidelines, and we sent them their guidelines to stay under quarantine or isolation if they were sick for 14 days. And then we called them twice a day, daily, to check on a very long list of symptoms. And we had about 3 people doing that initially with our preventative services division manager, our 1 communicable disease nurse that we have here, and then myself, actually. In the beginning, that's what our team looked like to respond to COVID-19. I'm an epidemiologist by training, and so I could definitely jump in and do that work, thank goodness. And so it was a lean in on all parts to monitor those travelers as they came in. And then as we moved through and we had the first case, and even though we knew it was a Umatilla County resident, I was talking with the commissioners here in Walla Walla and our Board of Health, Commissioner Johnson and Tompkins and Kimball, very regularly about, although we don't have a case in Walla Walla County, we have a case just to our south in Umatilla County. There are several cases in Benton Franklin County. I think actually Columbia County had a case before we did, had a confirmed case in Walla Walla that was related to travel. And so even though it's not here in our county, it's in our region. And I think a big thing with that is that, our community members don't see those county lines. They don't see state lines. They go wherever they're going to go. And so that was really important because we knew it was just a matter of time. With that first case that we had here in Walla Walla, we actually had 3 close contacts of that case who lived in Walla Walla County. And so we had to quarantine all those close contacts for 14 days and call them twice daily to monitor their symptoms. And so it was pretty much, we've been at this since February 28th, exactly 2 months. And I feel like I've aged about 20 years. I think I said that to Mr. Johnson last night. But I think that, we've been ready for this. I think that, for a lot of us that work in public health and that, I used to work for the CDC and their Ebola unit actually. And so like, this is kind of, at first it was really exciting to me, like, wow, getting back into it. Now I'm kind of like, okay, I'm ready for this to taper off a bit. But I don't think that we could have done everything that we did without the collaboration with the Department of Health, even working with Columbia County. As soon as Martha knew that they were going to be testing someone, she's like, oh my gosh, Megan, oh goodness. And so our team worked really closely with her, Anastasia. And that's what we can do over here in Southeast Washington. We know each other really well, and we know our healthcare system partners, which is not true for most of the rest of the state. We talk about, we know when every single person in Walla Walla County is tested, and we've tested over 1,400 people, but our healthcare partners here are telling us when they're testing people. And so if we needed to move to a system where we are monitoring even the PUIs, the persons under investigation, individuals who are tested, we could do that really easily here in Walla Walla, just because we know who they are. And we could get it going quickly here. And so I think that that's something that we just have really going for us over here in Southeast Washington, to be able to respond to an outbreak situation like this, is that we know one another. We got everybody's cell phone numbers. I don't have to call Jamie to say, hey Jamie, who's the health administrator in Garfield County? Oh yeah, it's no, and I think that just we have those partnerships already developed because we rely on one another a lot. where all our, public health has been underfunded and understaffed since the late 90s, I guess. And Dr. Yucca, our health officer, will say, well, Megan, back in the 90s. And I'm like, oh my gosh, like I wasn't part of public health at that point. But I would love to see what it was like then. I would love to get us back to where we were. And so what our case investigation looks like now, as we have at Walwall County, we have to date today, we have 61 cases of COVID-19. And so what that looks like, as soon as we get a positive case, our case investigators are notified, and our lead, clinical lead, Sarah Murray, assigns that case to one of our case investigators. We have 5 case investigators on staff identified right now. We plan to add more as we move through this, and thank you to our commissioners for the support in doing that. But we use the Department of Health's case investigation report, and we have added, depending on if we know or find out if the case is from Tyson, or if they're from First Fruits, or some of our other kind of outbreak situations, we have added a couple of outbreak cluster questions there so that we can better understand and help support those employer-related outbreaks as well. And so they hop on a call to notify our case. Most of the cases have already been notified by their healthcare provider who's tested them. However, sometimes we're the first person that they hear from, and it's been really interesting over the last 2 weeks as our case counts have really started to increase. For a while here, we were like, yeah, we're going to stay low cases. We had in the 15s, 20s, somewhere in there. But over the last 2 weeks, we went from some like 22 cases to 61. And so although, on the west side of the state, where this all first started, they're starting to see that leveling off of their curve, or maybe this way, we're still climbing. We are still climbing. Our daily case counts are still climbing. And they're not at the, in the sheer numbers that they're seeing on the west side of the state. However, we're seeing 4, 5, 6, 7 cases a day here still, and that's big for our size of communities. And I think that that's something we just need to be thoughtful about as we move through this next phase. I don't think it's on my slide yet, so I'll stop. But once we identify those cases, they have already been under isolation because when they're tested, they're instructed to go home and isolate, as with their household members, unless they are a critical infrastructure worker. If they're a critical infrastructure worker, they can return to work so long as they have the appropriate preventative measures in place, such as a mask and physical distancing, social distancing, sanitization, all those great things that everybody's been hearing a lot about. It's kind of like the dream public health thing too, is like everybody's thinking about public health measures that they need to be doing. Wash your hands, stay home when you're sick. Things that we've been trying to hammer into people for decades. And so with the case, we quickly get them under isolation and remind them to stay under isolation until we release them from home isolation, which is from 7 days from symptom onset, plus 72 hours fever-free with improving symptoms and no fever reducing medications. And so, and then any of their close contacts, we start on that contact notification process too. We quickly notify all of their close contacts and make sure that they stay under home quarantine, or if they have symptoms, that they go and get tested and notify their healthcare provider that they've been exposed, and then stay under home isolation for 7 to 14 days, depending on if they're symptomatic or not. If they work within a critical infrastructure industry, then we consult with them and with their employer as well. They need to always notify their employer that they've been exposed to COVID-19. And as we start to open up our economy with construction, and then with with golf courses and other outdoor recreation areas, that's going to become very important to know that all of our cases and close contacts, that they're notifying their employers. And because a lot of the times then we'll get a follow-up call from their employer saying, what do we do? Oh, sorry, I just shut my computer. And we're prepared for that. We We have several of we've actually been using our environmental health team under Kevin Turman, who's our environmental health manager, to do business consults. And so we've done several business consults over the last couple of months actually we started doing them in February because people were calling. They were calling asking, we want to be prepared. We want to be safe. We want to protect ourselves. We want to protect our employees. And so we've been working with grocery stores. We've been working with, we've been at Walmart a lot lately because we've got a couple of cases there. We've been working, of course, I'm sure you've all heard, a lot with Tyson Foods and also with First Fruits and several of our other large employers, Boise Cascade and Key Technologies, those. And some of them reached out to us directly, but others we worked with the port, with Pat Ray at the Port of Walla Walla and with Kyle Talbert with the Chamber of Commerce to identify a list of our largest employers to be able to reach out to them directly just to see what they need, because I think that's something. I've had 32 calls from contractors over the last 3 days saying, what are we supposed to do? Are we okay? Will you write our plan for us? I'm like, well, let me back up here. But we want to support them, and we want to help them be safe and help them feel confident in moving forward, and help them also know that they are part of the solution here as we move forward as well with reopening other sectors within their economy. We have to turn that dial on slowly and pause to see what that looks like, see if we have a large case increase, and then we can turn it on a little bit more and a little bit more. I think just being thoughtful about that. And so I think a piece here that we had that was really great that we implemented really quickly here was also a unified command. And so I'm going back for just a second. Sorry, you're moving me through my slides. So we have a unified command that includes, that's with ourselves and our emergency management director, and Commissioner Kimball sits in unified command, as with representatives from each of our incorporated cities, and then some of our large employers like the VA and of course Providence Healthcare System and the Army Corps of Engineers and our law enforcement representatives and emergency medical services, so on and so forth. So that we just actually got off that call. So Commissioner Kimball's got to hear me talk now for an hour and 26 minutes. That we talk through what our local case count is, what are effective strategies and successes, what are our risks and challenges, and what are our future operational plans over the next 24, 48, 72 hours for all of us, so that we can all be on the same page, because I think that our communities are small here, right? And so we need to have consistent messaging coming from all of our partners to reinforce the preventative measures, and also our appreciation to the community for holding tight with us in this really difficult time. I think, we've heard it called, we have a lot of fatigue within our business communities and with our community members. We've been under isolation and quarantine here for a long time. We're ready. And I think here in Walla Walla, with moving into phasing in our economy again, we're just okay, we're still seeing a case increase here. We have to be really careful with that. And I just need to make sure that we have, our big things in place here in Walla Walla County to make sure that we're prepared and we're able to respond as our cases increase. As we open up the economy, we will see a case increase. We will. And that's what it is. However, what do we need to have in place? We need to be able to test. We need to be able to test not only individuals who are symptomatic, we also need to be able to test close contacts who are asymptomatic. We need to be able to do the kind of testing like we did at Tyson. We tested last Friday 1,113 individuals. That was 9 people from my team and 18 people from Providence. This is a huge public-private partnership here that we have to rely on to move us through this. We're lucky here in Walla Walla. We just got Providence, St. Mary's Medical Center was just able to fundraise, however much, I can't remember how much it was, to purchase a rapid testing unit. And so they'll be able to run about 300 tests a day on site to get to not only, be able to result on our persons under investigation quicker, but also to be able to preserve PPE, because that's been something huge. And so as we move through that, not only do we need to test, we need to make sure that once we know about positive cases, that we have a workforce in place within our public health system that can quickly do what I was talking about, call that case, do the case investigation, which takes a couple of hours. And if they're Spanish speaking or another language, it takes even longer. And I think in a lot of our small communities, especially here in Walla Walla, we have several different languages that are spoken. At Tyson alone, there were 11. And so, in the language line, it's a struggle to work with, but we're lucky here that we have several, at least bilingual and Spanish team members who can assist with interpretation. But I have to thank our Commissioner Tompkins and Kimball and Johnson yesterday. They were able to approve really 3 additional positions for us. They'd already approved 2 new nursing positions that are temporary through December, because I have to say, I don't know when this is going to end. But hopefully, the second wave, will be less severe. Hopefully, we'll be able to jump on it much more quickly because we're staffed in a way that will, allow us to, very quickly do those case investigations, notify all of their close contacts, and get them under quarantine and isolation. Something else is, our quarantine and isolation plan, and having those pieces in place as well, because I think everybody has a plan, right? But then when you go to use it, it's always a little bit trickier. Like, oh, we need these MOUs in place, and we need to have security guards, and we need to have all these other pieces. And so, I think with staffing up our public health workforce throughout the Southeast region is going to be really critical to our ongoing response to COVID-19 and other emerging special pathogens. Who knows what will come our way? And so I'm really hopeful that not only do we staff up for this, but we're able to maintain some of that staffing as we move through COVID-19, because we don't know what phase 2 necessarily is going to look like, because we're still in phase 1 and we're just in the peak, or not even at the peak of our phase 1. And so predicting phase 2 is really tough, but I've got to kind of plan for the worst and hope for the best. But I have to say, I've really appreciated all of the local support that we've had from our commissioners, from the cities, from emergency management, and of course from our state partners. And Jamie's been amazing, and she's been in here when I can call her and say, oh my gosh, our other's worried about this. And I'm of course really excited to be able to go to my favorite restaurants and everything like that too. It's just that, reopening in a thoughtful way that will re-stimulate the economy, but also do so in that where we have some safety measures in place. And I'm really confident we can do that, so long as we have that investment in our public health workforce.
Megan, thank you so much. I really, really appreciate it. Very well done for being my volunteer last night late in the evening as I begged, and your cookies are on the way. Much appreciated. And that was a great overview. I think you really highlighted some of the challenges that you have that are unique to your area. Multiple languages, big manufacturing and agriculture centers. And I think that's really important to highlight that everybody has a similar response, but some very similar or very unique contexts in which they're responding to. So thank you so much. You did a really great job. And I'm very, very proud to represent you over here in Olympia. With that, Melanie, I will turn it back over to you. Thanks.
Thanks, Jamie, and thanks, Megan. That was great. I really appreciate it. Let's then now move to our overview from the counties on what has the impact been, and your response. What kind of impact have you had on county functions, on budget? There's a slide up that gives some ideas of things to talk about. It may not necessarily be the things that are going on in your county, so they are just ideas. Certainly when we were talking with the northwest portion of the state, we found broadband to be a particular issue, and it was evident on our own webinar. But in other areas for you, it might be something entirely different, given the more agricultural leaning to your counties. So why don't we start, if you are so willing, with Asotin County. I know we have a couple of people on the line, so whoever would like to go first, please do, and then others can jump in as they see fit. So I know we had Commissioner Subert at least.
Is Chris there?
Yeah, I'm here.
And
Wait,
Commissioner Shin as well. Please, either of you jump in.
Well, we'll let Brian, because I was just wanting to listen on this, so I didn't have any questions
Okay.
previously. Okay.
Well, I jotted a few notes. I guess one of the things that I would characterize, we very early on shut down our buildings as far as access to the public. We're wondering now when to start opening those back up. Also the courthouse as well as our commissioner annex, and when we'll be able to hold public commission meetings again. In our county, there's been a very strong economic impact. We have hundreds of people who have gone on the unemployment rolls, and through our local ADO, Southeast Washington Economic Development Agency, which is really great because it encompasses Whitman and Asotin and Garfield counties. And I know Columbia does similar stuff through their port down there. But we've even taken part of our money of our cash reserves, and we've set up our own program to aid businesses. There are limits, 5 or fewer employees, and no more than usually about $5,000. We've also got grants in from Commerce for $75,000, and we're screening those now. But the bottom line is we have hundreds of businesses that are sorely in need. So as far as a recap, you guys could probably all see this, but we've got 17 cases of COVID so far with only 2 deaths, more in the offing as we unfortunately know. And I think we are so far have no COVID cases in our jail. Chris, is there anything that you wanted to add to that?
Can you hear me? Sure.
Yeah.
Okay. Not really. Brian's been working more on this. As you guys know, we're trying to replace a commissioner right now too. So it's just a little crazy right now. I've been trying to talk with all of our elected officials and department heads. Everybody really wants to open back up the courthouse and the annex. I think we're going to have a meeting Monday with all the department heads and elected officials, and then just kind of go from there. I guess we need to wait and see what happens on the 4th at midnight also, correct?
Well, I don't know if anybody else is getting the same kind of push that we're getting. I know we're not supposed to talk about construction, but it's up and running, thank goodness. And some of those people are going back to work. One of the questions I had about this CARES money, importantly, when are we going to see it? And how, what's the reimbursement process? So I hope there are guidances on that coming.
I'll touch on that just briefly. Eric Johnson, our executive director, has been our lead on that. And unfortunately, he had a conflict this morning, so he's not on the line. But there is a distribution, an allocation plan. The state has set aside about $300 million, and it will be divided up $60 per capita per county, and that's for incorporated and unincorporated, and then $25 per capita per city. I think the idea there is that each county will receive at least $250,000, and each city will receive at least $25,000. And out of this pot also comes the cities in the counties that are over 500,000 that received the direct distribution from the feds. So using Spokane as an example, they received a direct distribution. They don't then distribute that further. It comes, for the cities, it comes out of this other pot that went to the state. And in terms of the when and the how, that is being discussed by the governor's office and Commerce, the Department of Commerce this afternoon. They are trying to decide, is it a grant? Is it a reimbursement? Is it just pushing the money straight out, or how are they really planning? So that's all happening this afternoon. So we don't know exactly what it's going to look like, but they are certainly aware of the urgency. This is supposed to be for costs incurred that were specific COVID-related response dollars. And it's supposed to run through, I want to say, but don't quote me on this because it could be wrong, the beginning of March through December. And then there is another chunk of funds set aside for second wave type responses, testing and hotspots and things like that. So there is probably more money to come. They're just dividing it into the immediate and the future. So hopefully soon. We did send out an email this morning that has the allocation sheet on it. So take a look for that. And if you can't find it, don't worry. We can just let me know and we can send it back to you. So
Melanie, I did look at that, and I noticed that when this first came out with the estimates from Eric, we were talking 3 million for Stoughton County, and then it was 2 million, and as of this morning's email, it was 1.3 million. And I know we have to backstop for future COVID expenses, but a portion of this is able to be used for economic impact of businesses. And that's very clearly stated there. So I guess I'm wondering, does the money go to the county into a fund, and then is X amount earmarked for economic recovery, and X amount for COVID-related expenses? How do we know how that's going to work?
I don't think we do yet. I think that's part of the discussion this afternoon, is whether they will just give you the money, and obviously with the appropriate accounting in place, but let you decide how to deal with it, or if they will have you spend the money and then seek reimbursement. And they have not decided that yet. I mean, the one thing that's been very clear that we know is that we can't make up lost revenue with it, but I think that's like the clearest statement I've heard. In terms of the specifics of how it's going to get to you, those are really the unanswered questions right now.
Thanks.
And I suspect, although I'm just guessing, and I wish Eric were on the phone, but that original number he sent you, my guess is that was the full dollar amount before the state decided to divide it up into the two parts, because that roughly would be 50%, I think, of what you were talking about. And I think it's a roughly 50-50, although not quite. So that makes sense to me, but I don't know that for a fact.
Thank you.
Yeah, definitely. I'm glad I knew a little bit anyway. Anything else from Stoughton County before we move on? Okay, I'm not hearing anything. So why don't we move to Garfield County next? And I know we have Commissioner Johnson at least. I'm not sure about anybody else. So we can maybe start there and see how we do. Commissioner, you'll have to unmute yourself.
Commissioner Johnson has some technological challenges, so good luck to you.
I'm looking for him on here. So maybe we'll skip Garfield for the moment and come back to that. But I have to move one computer to be able to look at the other screen. It's very high tech what I have going on right here. So why don't we move on then to Columbia County, because I know I can see Commissioner Amron, and so I know he's there.
Hey, Melanie, we can't hear you.
I'm sorry?
We can't hear you. Looks like your camera might have fallen too. There we go.
Well, I had my camera in my hand,
Okay.
but
You must be covering up the microphone.
probably. So why don't we move on? We'll try to figure out Garfield, and we'll move on in the meantime and to Columbia County.
Hello, everyone.
Good morning.
Mike, you on here too? Commissioner Talbot should be also on here, I think.
Yeah, I'm here.
Hi, Melanie. The biggest thing we're working on right now is just expected lost revenue for functions of government. We had a lot of our businesses are still open. The wind. Pool. There you go, Mike. I have heard that. I just heard back that
Commissioner
Got it, Mike?
Amrith, maybe you're very choppy, so sometimes what helps is actually if you turn off the video and we just hear your voice, it comes through
Right.
better. Let's try that.
I live in a technologically reduced area. Let's put it that way.
Well, that
But
did
our
help,
big-
so thank you.
All right. Our biggest concern has been the lost revenue and for state government. I don't think we've had any huge problems I know of. We have, like I said, one of our larger new employers, it might not be doing so good. Just trying to find ways to cut our budget so that we can actually afford everything. We haven't heard anything about the CARES funding coming in yet. We're waiting to hear about that. We also had a flood just recently, so we were trying to deal with that and the funding to repair the damage and everything. And then this happened. So we're still trying to play catch up with everything. But I know our public health has been doing a good job of tracking, tracing the contacts, things like that. And, yeah, we don't have any more cases. Actually, our one case came from someone traveling abroad and bringing it back. So we've done a really good job of limiting the spread. Our hospital is very ready for it, but we just haven't had the cases. And we kind of live social distance already, and we just haven't had a lot of it. Mike, you got anything?
Not really. The new regulations for the golfing and that are confusing for small county because we have a hard time having somebody down at the golf course all the time. And so we're really not going to be able to open it quite the way people will want it to. So that's one thing that I haven't heard yet. So.
Right, the governor's, opening up of the construction industry, light construction, and then yesterday talking about opening up some recreation on the 5th is we're looking forward to that. That'll certainly help. A lot of our businesses are based around tourism, but we're just reacting. We're trying to get ready for what's going to happen down the road. That being unknown.
Right.
So I don't really have anything more. I mean, it's just unknown, and I'm not going to use the U word to describe it because everyone uses it, but it really is without anything to compare it to. It's we're trying to figure out all the things going forward that we can react with the fairs. What we're going to do for the fairs, what we can do for our facilities. It's a lot of unknowns, I guess.
Definitely. Yeah. Anything else from? Oh,
No,
let me
nothing for me.
Let me see. We have something in the chat box. Let me look really quickly. Okay, never mind. It's not a question. So I just wanted to make sure before we moved on. Okay, I'm still working on trying to figure out what happened to Garfield County. I think I'll send him the phone number just in case he needs to call in. So let's move on to, how about Walla Walla, where I think we have Commissioner Johnson and Commissioner Tompkins, I believe I saw.
Yeah, thanks, Melanie. This is Greg Tompkins. So just for clarification, I just want to make sure. So the $250,000, they're going to discuss that today so we can figure out what to do with that money. I mean, I know there's strings attached to that. And then it sounds to me like I read the spreadsheet that had came out earlier, and it said Walla Walla County was in line for $3.4 million, but we can't use that to backfill lost revenue. Is that correct, what I heard you say?
That is correct. And there's been debate. There may be another package coming from the federal government that would address lost revenue, but so far, no. I feel like that's the one thing that they've been very specific about, actually. The rest of it's a little more open with that exception, I'd say.
Okay, and that's unfortunate because
Yeah.
at this point then, we have given direction to all our staff, all our departments, to look at a 5% reduction in their budget, which has created some consternation and some battles in the paper, unfortunately. I was hoping that $3 million, if we knew we could get it and use it, then we wouldn't have to go through that process and potentially risk losing some employees. I will say the other thing that we've had to do is we have spent money on laptops so employees can work remotely. We either have employees working remotely or we have shifted them. So one week, this number of employees work in the auditor's office. The following week, then they just split it up, trying to keep some semblance of a staff without getting the virus. Some of the challenges that we have, we've reduced our courthouse hours based on the ruling from the Supreme Court about court. So we're only open 9 to 2 at the courthouse. We have not heard any comments about those hours, so that could be something moving forward if we have to reduce our budgets, is just keeping the courthouse hours reduced and then potentially having to reduce employee hours. We don't know where it's going to go. They're all kind of suggestions right now. Moving forward, I think with Megan and she's doing a great job, is how do we deal with employee fear and making sure that we have protection for them. The other thing that we found out, because we're doing all our meetings by WebEx, our backup has become full. So we're having to spend some money to bolster our backup. And then the last 2 meetings, we've come up with a low bandwidth signal, which has impaired the meeting. So we're trying to figure that out. It hasn't been till just recently that's happened, but it could be because of the number of people dialing in to work remotely. I did hear Commissioner Hammering from Dayton mention the fair. I've sent a note to Salvador at the governor's office. He sent me to fill out the form for businesses that have questions. So I sent off an email today, filled out the form. If we're not going to be able to open without restriction come Labor Day weekend, I think we need to, as a board, figure out what we're going to do with the fair, because we're not going to be able to, we're going to lose money big time if they put restrictions on crowd sizes. So I'm just asking them to either give us an answer if they think that it's going to, or if not, because that's an RCW, give us a dispensation that we don't have it this year. I mean, and I don't mean that's not my decision. I mean, I'm asking for guidance, so we can make a decision, because that would be a huge loss to the county current expense if we lose a ton of money at the fair. Those are the things that we're doing as far as dealing with the COVID right now. Again, I'm sad to hear we can't use any of that, because I'd love to keep everybody where they're at, but it doesn't look like we're going to get to do that. And then I think down farther we can talk of ideas. Do we have any legislators on the line, Melanie?
I'm sorry, I'm talking to Commissioner Johnson on the phone. We do have at least Mary Dye on the phone, on the line.
Okay, but we're going to talk about things they can help with later.
That's our next step.
Okay. Commissioner Johnson, do you have anything?
Well, I think all the commissioners can probably sympathize with what I'm about to say. One of the interesting aspects of the dysfunction of county government, unlike cities, is that we have department heads over which we essentially have total control. I mean, they work for us. But we also have a lot of independently elected officials. And it's not always easy to get them on the same page in terms of what they're thinking. So we struggle a little bit with some of the offices of the independent elected officials on hours of operation and that kind of thing. We're working with them. I mean, we don't have a dysfunctional relationship by any means, but it is a little bit difficult when there's a difference of opinion on how things should go. And particularly when we're talking about how we get back to a more, and I hate to use this word because it just doesn't work anymore, but a more normal work schedule. As Commissioner Tompkins mentioned, people are concerned about going back to work. So we're going to do wholesale, we're going to do testing of all our employees before they go back to work, or just exactly what's that going to look like. And if one department under one elected official says, no, we're not ready for this, and another department says, yeah, we're ready for this, how does that look? It's a difficult situation. As you might expect, when we have talked about budget cuts, and we're looking at, I think we're looking at $1.5 to $2 million, depending on how long this goes, hit to our current expense. We're taking a lot of flack from, law enforcement, to be honest with you. Our commission deputies, and certainly they're entitled to do this. They have a social media page, a Facebook page, and they put out that, their jobs are more important than other county jobs, and so they shouldn't be part of the budget cuts. So, those are things we all have to balance, and they're not easy decisions. As I told someone yesterday, all of the decisions that commissioners are making having to do with COVID-19 and this pandemic wind up being bad options. There are no good options here. So we're faced with choosing some options, none of which we like and none of which we ever expected we'd have to do. So we're getting pressure from both sides. I can tell you we got pressure when it came to Tyson to shut it down immediately for at least 2 weeks. And then we got pressure from other people saying, well, those people need to work, and, we need to open up the economy, and, Tyson's part of that. We need to deal with it. So we get and I'm not telling commissioners anything they don't know, but we're getting pressure from all sides. And it's what I tell people is it's our responsibility to have as much information as we can gather, as much data as we can get from our public health people and others, and make the best bad decision we can, and take the flak for it. That's just part of the job. So again, as Commissioner Tompkins said, I'm a little disappointed we're not going to have a little more leeway in what we use those funds for, because I think there's a lot of things that are having to do with this that you could certainly say are tangentially related to COVID-19, that have to do with our revenue shortfall. And I think it's a little short-sighted that we're not going to get a little more leeway in that regard. So I think that's about all I have.
Okay. All right, well, we're doing doing a little bit differently, I guess. So I just had Commissioner Johnson from Garfield County on the phone. He said he can see us and hear us, but for some reason he can't talk to us. And I can't figure out why that is, because I honestly don't even see him on my list. So I am just going to give you a very quick report from him, and then we will move on to Whitman County, and then we will move on to our other subject. So I apologize for multitasking, but I think it was worthwhile. Commissioner Johnson reminds me that they are the one lucky county so far that still has no diagnosed cases. And of course, as testing increases, that could change, but so far, so good in that regard. They are interested in opening up businesses, but wanting to do so very carefully, because obviously while they have no cases, they do have neighboring counties who do, so wanting to be very thoughtful in regard to how that works. They are, despite the fact of not having any cases, are losing revenue like everyone else, because the shutdown still applies to them. And so for them, it's really sales tax and fuel tax. And especially since there is not a huge population there, not a ton of businesses there, when one closes down, for example, that has maybe a disproportionate impact versus, or when one is able to, one type of business is able to reopen, might have a greater impact for them than in a larger county. So I think that's roughly what he said. He said everything else that you all have been saying really rings true for them as well. And he said he could see your, well, I'll just say it nicely, Commissioner Largent, he could see your face on screen. So he knew that you'd say something that he probably agreed with. I'll just kind of quote him like that. So with that, why don't we go ahead and move on to Whitman County? And I think we have Commissioner Largent and Kinzer on the line.
Well, I'll begin because I don't see Commissioner Kinzer at the moment, and I'll just begin by saying I'm so shocked that the esteemed commissioner from Garfield County is having trouble with his computer, and I think Commissioner Subert from Asotin County will underscore my observations. We're going to very quickly begin to sound like a broken record, and I think Jim from Walla Walla articulated many of the things that I would have said, as well as the other commissioners. We're spending a lot of time talking about the disease itself. The issue in Whitman County, of course, is going to be budgetary. I have a lot of questions with regards to the CARES funding, and I would underscore that I too am disappointed in the lack of flexibility. I'm glad Mary Dye's on. Mary Dye has been a friend to counties during her tenure as a representative. But from a broad scope, I would suggest that one of our largest cost drivers in county government is in fact state RCWs. And in this time of flux, I would certainly appreciate the governor's office and the legislature looking at some of the cost drivers that are creating problems for counties, and realize that the basic services that we provide are just as important now as they were before the pandemic. And I don't have any specific RCWs in mind to offer, but I would suggest looking very closely at legal requirements on counties and see if there are any that we can suspend for a period of time during this emergency. I don't think we have, I think we're all quite concerned, but I don't know that we have fully appreciated what is going to happen for the remainder in 2020 with regards to our capacity to deliver local services. I think we're getting close to the point where we're going to have to say there are some constitutional and statutory requirements that we are frankly unable to comply with. And there needs to be a broad recognition across the state and the governor's office and in the legislature that frankly our local services, is an extension of all what the state is delivering. I don't think there's been a full appreciation that we continue to need our regular public health, our sheriff's department, our courts, our assessor. All these things need to continue to function. And if we lose the capacity to deliver that, then what? So I'm just going to throw that out there. Whitman County is doing fairly well with regards to COVID-19. We have 16 cases, 12 of which are fully recovered, 4 of which are sheltering at home. We have had no hospitalizations. The fact that WSU is closed down may contribute to that. I think the stay-at-home order may have also contributed to that, but I'm very concerned about a second wave coming when the university returns and they bring all their exposures back into Whitman County. And our capacity to test and get data will be absolutely critical in our capacity to make decisions. I'm hoping eventually we move to a more regional approach with regards to our responses so that we can be more locally oriented. But the reports from Whitman County now is good, and as far as the disease, bad as far as the budget. And with that, I'll move on.
Thank you. You did raise a couple of points that I wanted to follow up on. Do we have, but before I do that, do we have anyone else from Whitman County who wants to speak? Okay, so you jogged my memory on something that I had a question about. which is, I know we have 10 counties that have April elections, but I don't know off the top of my head which counties those are. So I'm curious when we move on to our next set of discussion points, if any of your counties are facing that, and if so, how are you dealing with the idea of same-day voter registration and things like that? Another question that I have for you moving forward into our next is something that we've heard on other calls but hasn't come up so far today, although just kind of a little bit, is with the courts running at a lesser volume, are you concerned or hearing about potential concerns in terms of a backlog that's piling up with cases, and what will you be doing with that? And then I would also say you touched on a couple of things that we've heard on other calls as well. So there's definitely a theme that's emerging in some of these, which is, while we know revenue and resources at the state level are going to be very tight, and it is probably unrealistic to expect new money from the state level. Hopefully we will receive some from the federal level, but there are things, even if we can't get new money from the state, there are things the state can do to either not compound the problem or ease up the problem for you all. And that would be, don't add any new unfunded mandates to the list. Maybe suspend some of the ones that you have already, at least for a period of time. Suspend regulatory and some of the RCWs, like you said, Commissioner, adding fiscal flexibility in. So there are statutes and funds that come with non-supplant language, for example. Maybe there's a period of time where we can remove some of that language so the funding can be used more broadly. So you don't have the situation where you have one really robust program that might not be the program you need right now, for example, and you have a program that you do need desperately that you can't operate because the funds are siloed. So I think those are exactly the type of things we need to be looking at, and we need to encourage our legislators to be looking at as we move forward through either a special session or perhaps even if there is a special session, into the regular session as well. So conversations we absolutely need to be continuing. And with that, I want to just reverse the order, and so I will turn it back over to Commissioner Largent to talk about, and we can move the next slide, Mitch. What comes next? What's on your mind as we move into the next phase of what's going on?
Well, I'm at a disadvantage because I'm just looking at the new slide as we proceed.
Yep.
Whitman County, with regards to our operational issues and response to COVID-19, has taken a more decentralized approach. We have asked our department heads and our electeds to essentially manage their staff and their offices on their own. It's difficult for us from our position to really ascertain the management challenges these departments have. But we, like everybody else, are struggling to accomplish the duties that we are obligated to perform. Back to the our budget problems. We don't really know. Back to the unknowns. We don't know how it's going to look. The unknown is hard. We're struggling with the fair. We need to make a decision. We don't know what the governor's going to do. But based on the unknown, we continue to have to make decisions. And for myself, I'm much more risk averse than I may have been prior to this. So if I see any potential challenges to our budgets, I'm going to suggest we not do it. I do anticipate, as we move, we're in a fairly decent cash position for 2020, moving into 2021. I think it's fair to say that we're beginning to consider furloughs, maybe even layoffs, not knowing what the new normal is. We're not knowing if the state legislature is going to be more appreciative of the duties and obligations that counties are constitutionally and statutorily obligated to provide. We may be down to the absolute basics, Our role in the economy is distributing money. We got the additional CDBG grants that we're going to be allocating. We tend to try to push the money out towards organizations that already have the structure to identify the most needed economic development cases. We don't have that structure in the county itself. So we tend to go out to affiliate organizations to assist us in that. We'll do that with the CDBG money. We'll probably ask for a lot of help with the CARES money to push that out to businesses, because little county like Whitman County just does not have that economic development infrastructure in place. And we're not going to get it in the near term. So we have to identify partners that are going to help us reopen the economy with the funding we have available. What scares me right now, back to the budget. I don't know how we're going to pull our horns in enough and still maintain our compliance with the constitutional and statutory requirements without some appreciation at the governor's level and at the legislative level that these are not normal times and we won't be able to accomplish what we normally have done. We might end up out of compliance, and how will we be dinged by doing so is an unknown. I'm willing for Bob Johnson to go to jail on this case because he is a brave man. But there's a start. Get the next victim, see if they can do better.
Well, I just assume they can. I'm kidding, because actually I am going to say something now, so that was completely on me. If I were going back up I was going to go to Garfield County, and of course, we don't have the ability to really talk with him, but I would just reiterate what he told me in terms of sales tax and fuel tax and transportation issues as a result of revenue lost. There is something that hasn't come up on this phone call, but something that has come up elsewhere. So I just wanted to mention that really briefly and to get a dig in when I could.
And I can speak on Commissioner Johnson's behalf that he's willing to volunteer for any duties you may have. He's open to volunteering for anything.
Perfect. Okay, with that, why don't we move then to Walla Walla County? We have a couple of commissioners on the line there.
Thanks, Melanie. And Mike, I just want to make sure that clock in the background, did you steal it out of the courthouse remodel?
That's a classic, Tompkins.
Okay.
That's a classic right there.
Just checking, my friend. Thanks to Mike and what he said. So some of our things, of course, echoing is going to be our budget and what do we do? And like Commissioner Johnson said, we're big boys and gals, and we're just going to have to take our beating because, law enforcement makes up a large part of our current expense budget, as well as our law and justice budget. And without the sales tax revenue, I don't know how we're going to keep it going. But that's the sheriff's decision once we get there. Melanie, you brought up gas tax. We heard from our public works director yesterday to look at probably about $700,000 in reduced revenue just from the gas tax. So we did get a FEMA declaration for our flood from the governor, or from the president. So we will be potentially getting money to repair the damaged bridges and stuff, but that still takes away from a lot of our routine maintenance. I will say, I think we have Representative Dye on the line, and I'm a broken record, but this is kind of one of my bailiwicks is if they do go back, House Bill 2490 for that 9/10 economic development money, where they're asking for an extension to 2052, we really can use that because it sunsets in 2 years. And if we're going to use money to help local businesses out of that fund, we have to have some certainty that the state's still going to partner with us and allow us to continue using that fund and maybe make it a little more flexible for the uses in that. And then I was talking to our civil attorney, and this again is for Representative Dye, is some type of immunity to counties for employees that do kind of have that fear, you know, of coming back to work, or even people coming into the courthouse or the chambers. As long as we're following the guidelines from the CDC put out with sneeze guards or social distancing, that we have some assurity that we're not going to get sued because we're providing the services that are required by the state legislature. And so that's a concern, and I'd really ask the legislature to look at that. And then also maybe we're getting all these vague proclamations from the governor, you know, would be to clarify some of these in statute, so we know what to do, because basically we don't. I mean, it's clear as mud, they say, right? I mean, he puts these proclamations out, but nobody really knows what to do, and you can't get answers from them. I sent 3 emails already today, and, you know, and I get, fill out this form and send it here. And then, you know, we've been getting people wanting to get extensions on their fishing licenses. Well, that's not the governor's office. That's either Fish and Wildlife or the legislature. So, I mean, it'd just be nice to be able to get some guidance, because this is my 14th year, and this is the most confused I've been. And I am easily confused. I don't want Largent to come out and say that. But, and then again, that's why I called my attorney, because I was thinking joint and several liability as part of this, but he didn't know if that would qualify. But he said it wouldn't hurt you to say it. So Representative Dye, if you want to help with joint and several liability, which we've been working on for the 14 years I've been a commissioner, we'd greatly appreciate it. But with that, Commissioner Johnson, do you have anything?
No, I think you said it well. I really don't have anything to add in that regard. So good job.
Well, I am glad that you brought up a couple of things that haven't really come up on any of our calls so far. So it's great that you raised them. And one is the 0.09, which we did have a bill to extend and actually expand this last year, which didn't pass, I think, in part because it is state sales tax revenue, which brings me to the point that I wanted to mention is we do have a certain amount of revenue that is shared with the state. And as we are looking forward, one thing that will be important, I think, is to protect that shared revenue and not have the legislature see that as a pot of money that they could draw from, because it is going to be important for you to keep that. One legislator on an earlier call had mentioned, someone asked if we could speed up the funding for the even year elections, and she mentioned that we'll be lucky if we're able to keep that bill, let alone speed it up and have it come online faster. So shared revenue and protecting those sources, I think, is going to be really important. And liability, I don't think we can underscore this one enough. We are all dealing with something that no one has ever dealt with before, and we don't really have standards of care in place. And it will be very easy for someone to come in not knowing they are sick and spread the virus. And so what do we do in regard to those employees? Or you're allowed to open up the fair, for example, and someone comes in and someone else gets sick, and are you liable? And is joint and several liability something that we need to worry about? Those are all really great questions, and ones that we had asked the governor, and he has been reluctant to engage in that thus far. So it's probably a conversation we're going to need to have with the legislature. So I appreciate the fact that you brought that up, because I have not heard that on other calls. So next on our list would be, how about Columbia County?
Hi, Melanie. Yeah. So in our county, most of what the county provides is just the infrastructure. And in our case, we have about 600 miles of roads. We have a very small crew to deal with all that. And the gas tax shortages are going to hit us really hard. We're looking at almost $1.5 million shortfall just from gas tax, and other things. That's the one that's really impacting us. We're going to be cutting back on road maintenance, chip sealing, gravel, just everything, while trying to repair from the flooding. So that's the biggest one right there. Our county roads are being affected. Our departments are all fairly small, very few employees. A lot of the positions are grant or otherwise funded through outside sources. As long as that money comes in, we don't have to worry too much in some of those respects. Some, if we do cut an employee, we lose other employees just because, our grant funding is based on having certain people. So trying just to provide the basics with what we have is going to be difficult. And we're gas and sales tax are both down, which is a problem. You said, what do you anticipating moving forward? One of the problems I see is that this year our property tax collections aren't too bad, but everyone's had a good year behind them to save up and pay. I'm worried that next year, with reduced economic activity, next year we'll probably see a decline in property tax collection also, in addition to sales and gas tax. And that's concerning. So again, we've put it out there to all the departments that we need to start, looking at cuts. We told them, make cuts with the view towards the long term, because we don't see this as a short term type thing that will probably have to be cut back for a bit. And also, have a plan to cut back to just the bare minimum of what RCW requires we provide if we can. We don't want to let anyone go. We really don't want to do that, but it's looking already like with the, we're going to have a hard time telling people we're going to keep fairgrounds and golf courses open if we can't even keep the snow plowed off the roads in the wintertime, or repair, chip seal or road stabilized gravel roads. It's going to be difficult. So we're looking at that. I don't know how we can assist in restarting the economy as a small county like ours, but we do provide our biggest resource is the wheat. Unfortunately, we export most of it to the East, Asia, and that might be a problem if they don't open the markets back up. But we will try and keep the roads going. That's what we've put the petition out there for, is to keep our roads going so we can move equipment to fields and crop to market. Very important. And again, that's going to come down to public works money, which partially, my engineer tells me that sometimes when they're trying to get the economy boosted, they put money into public works projects, which we hope we'll be able to do. And I know we've been working with Garfield and Asotin County as far as public works go, or at least on the engineer level, to try and coordinate activities so we can make this work for our counties. But, other employers I'm a little worried about. We did lose our, our pulp plant did shut down, but we also have windmills, large quantity of windmills, and I don't know how much we'll be willing to, the government, federal government, state government will be willing to subsidize green energy that doesn't actually have a good energy return on energy invested payout. So I don't know if that's going to continue and if they'll be able to stay going, if we'll be stuck with a bunch of windmills or not, I don't know. But what scares me right now and looking ahead, two things are, the first one is you pump $6 trillion into the economy out of thin air. You look at hyperinflation, and down the road, year or two, I see that being a real problem. And the second one is with all the, I know that we're supposed to be on the upswing. The case count in the United States is slowing, and deaths are slowing, but we're losing a lot of meat processing plants and things like that are starting to have problems. And if we don't get that sorted out quickly, I'm a little worried about food shortages, because as they say, 9 meals from anarchy. And we're relatively safe. We have a bunch of big neighbors around us that have a lot of people, and that concerns me. So what scares me is hyperinflation and food shortages. Mike, you got anything? You gotta
Yeah,
unmute,
the only
buddy.
thing that I can say is that because we're losing so much money in the public works area, we are really probably going to have to cut down. And so we're actually, some of our old employees, we're asking them if they want to take early retirement. So we're thinking that maybe it'll keep us from having to actually lay anybody off if they do take the early retirement. So that's something else we're looking at. I think that's it.
Yeah, I'm done too.
Thank you. Really thoughtful responses. Appreciate it. And food shortage is one that, we've heard about more recently and hasn't come up too much, but I think it's a really valid point. And so last, but most certainly not least, we are left with Asotin County and Commissioner Shin. You are on mute, sir.
I guess I was asking if Chris Subert wanted to go before me, or if he's still there.
Well, I'm still here, but go ahead if you're, I got just a couple things I need to say, but go ahead first.
Okay, well, in order to get the county dialed back up, it has to be safe, it has to be gradual, and it's going to take money. We need the maximum amount of flexibility to be able to stimulate those businesses, help them bring things back online, and they can start collecting sales tax. I think we're somewhat fortunate in that we have a Walmart and a Costco, and they have all had record numbers of sales. I think one day Costco beat their previous day record by over $300,000. So I don't know that we will see the immediate impact of a shortage in sales tax, but it will eventually occur. And we have a strong need because there are so many hundreds of people that have lost their jobs. We have a strong need to be able to help those people. And one way we can do it is to get businesses going again. That's what I'd like to see us do. As far as the new normal, like everybody says, it's unpredictable. Nobody knows for sure. In hindsight, we can't do anything about the fact that we shut down the entire state's economy, even if we didn't have a direct, definitive, data-driven need in this part of the state. But that did occur, and we can hope that it plateaued the cases, and the governor is finally starting to bring things back. Somebody said that we needed, I think it was Mike Largent, that we need to relax some of the standards. I find it ironic that we never had any money to support our indigent defense, but all of a sudden, before anything happened, we had $200 million from the state, from the overabundance of sales tax collection. We need to, as Mike said, we need to get them to relax some of the rules for these unfunded mandates. And I don't know as far as budgets go, we're preparing for the worst. We even contemplated, we haven't done anything, we even contemplated about reconvening the salary commission and cutting everyone, including our own pay. If we're going to wind up cutting the employees of the county, shouldn't we all share in the pain? I don't know what we're going to do. It'll be somewhat delayed, I think, but somebody else said 2021 is going to be a killer. We're going to live with this for a while. And I don't even want to go on the national scene as far as the $2 trillion, but I don't know if I answered what you wanted, Melanie, but there's where we're at. We need to be able to help our businesses. The businesses open, people start spending, people start working. We need to do it safely. We need to have social distancing, but to me, that's the key. Restart the economy. Chris?
Mute. There we go. You can hear me now, right?
Yep.
Yes.
Well, the things that Jim Johnson said just drove home to me was a ton. I've been in a lot of retail businesses in my life. I've been the boss. What I said kind of, you got done. Jim, you have a lot of elected officials. We were just talking about it this morning. We have our courthouse closed down right now, but we're doing business as normal as much as we can, the new normal. I talked to a couple of elected official department heads. Some of them want to open up, some don't. How are we going to practice social distancing? et cetera, et cetera. So that's the part what scares you right now. I'm looking ahead. I don't know how to go ahead. I think Greg Tompkins said he's been a commissioner like for 100 years or something. And this is the first time in my 3.5 years that I've been really, really nervous on what I'm supposed to do or how to do it. We just need better direction. Someone else said on these proclamations, they're impossible to follow. We had a public health meeting, I think it was 2 Fridays ago, on construction, because we'd had some businesses, constructions that were started, got a letter into the governor somehow through our representative, and they were deemed essential, and they were not anywhere near being an essential construction project. So what we did is we decided, and we try to draw attention to ourselves. As far as public health board, we decided that the complaint process would be shipped back to Olympia through the website's phone numbers. And the only time we would enforce a construction shutdown was if it came from Bob Lutz, our regional health officer. So we want to step out and fix things. But again, that's kind of what scared me. How much trouble can we get in or not get into? So there's a whole lot of statement there, and I don't even know if there's any questions you can answer. So how was all that?
That was good. Thank you.
And tell Largent not to respond to anything I'm saying.
All right, we'll just keep him muted.
Thank you.
I think that gives us everyone, and we are right up against our time, but I do want to make sure we have the opportunity for anybody to ask any questions. Our chat box has been pretty unused today, so I don't have any to read to you, but why don't we just take a couple of minutes. If anyone wants to jump in with any questions, let's go ahead and take a couple of minutes for that.
Hi, Melanie. This is Greg Tompkins. I just, you guys are doing a great job getting information out, but as soon as you guys hear on any clarification about the $250,000 and then the $1 million of what we can do with it, because I had this conversation with my the sheriff's office yesterday. They're applying for a grant. I said, okay, but how much money you're going to get? Well, we don't know. I said, well, I can't have your expenditures be larger than what your grant is, because we don't have any money. And that's my fear. The commissioners here are rotating weeks in and out. It's my week in the office. So the clerk of the board and I were going through, okay, what could we do for, sneeze guards or things like that to protect and get our 6-foot distance if we don't have it in the commissioners' chambers. But I don't want to move forward with an RFP to have somebody come in and do some, custom shields or something that we would leave up forever without knowing I'm going to get that money and I can pay for it. But I mean, and reimbursable grants are great, but they're not great at this time because we don't even have the money to pay the bill when it comes in. So that would be my comment.
Yeah, we'll check in with the governor's office this afternoon after they've had the conversation to see if they've made any progress. So as soon as we know anything, we'll get that information out to you because we know how important it is. And it's a great point about the reimbursement versus the just putting the money out there grant style. So
right, just don't send it in a proclamation because you've heard we don't understand those.
You're not alone, sir. Yeah. Representative Dye, I see you're unmuted. Did you have a comment or question?
I do have a couple of comments. First of all, I really appreciate what you're saying, and I have some insight into some of it. If WASAC could put together maybe a working list of some of the unfunded mandates, I could remember some of them, like the PERS one, the PEB, indigent defense has been a forever, but I can't come up with all of them from the top of my head. And so you probably have a better insight from your membership. And that would be very helpful for us to be prepared. In terms of a special session, the way that the legislature is constructed right now, there will be the conversation about increasing a tax of some kind, whether it's a carbon tax or an income tax. And from our staff, it's fairly clear that we are in a good, there's sufficient funds. So we're thinking that, you know, the special session is more optics and than it is necessity. And we would avoid trying to put in a special session if we thought that it was going to be about increasing tax burdens on people that are already really in a bad position and not remedying some of these other structural problems that we could. I can't answer on the fares, but I'm going to bring that to our leadership to take to the governor, because I don't think he would even, fares wouldn't cross his mind. On the sunset bill, if I could get that bill number, was it 2490? If I could get that, we could deal with that in the next session and be ready to rock and roll with that in the pre-filing. And then on the safe harbor or the immunity, legal immunity, the joint several liability, I've been working at a national level to get model policy language from some phenomenal attorneys, and that should be available to me next week. And I can start floating some of those ideas out with you to see if it provides sufficient protection, and we can start massaging that language. And so the reason why I would oppose a special session mainly is we'll be getting our revenue forecast in June, and I'm sure that it's going to look horrible. But like I said, we have sufficient funding available to get us through to 21 session. But the other thing is we don't know how much federal dollars will be coming into the state. And when you have the amount of appropriations that have been made at the federal level, the gleeful spending that they're going to be doing, I think that we need to wait and see how that comes out to play. It may be something that really is a game changer. And so I think that it would be foolhardy to be jumping ahead of the gun on that. And I will look into also some of those flexibility issues. I think they tend to be, I don't know exactly. I'll reach out to Lisa Brown on that. But thank you so much for bringing all of this to us. And it gives me a lot to go with. We have a meeting here very shortly, and I can take this to leadership. They have the opportunity to at least attempt a conversation with the governor. And sometimes that doesn't go so well. I'll just be honest with you. But it still brings the issues up and puts pressure on him. And so it really does help all of us in our minority party to have really the pain on the ground is real. And I think that we need to make the governor very aware of that. So thank you so much for letting me listen in and get a really good handle on it before we go to our meeting with our caucus.
Well, we definitely appreciate the fact that you were willing to take the time this morning and listen in, and keep an eye out for an email from me. I'll send you that bill and some other things that you just talked about. And again, thank you very much. We really appreciate your support right now and in previous years. So we really appreciate having you on here. We are over time, but do we have any other questions or comments before we say goodbye?
Melanie, this is Greg again.
Yes.
And I probably shouldn't even bring this up, but in the community I live in, and I would be willing to bet there's some other small counties, if they start talking about increasing taxes, and we're already hearing it about the religious, liberties and not being able to worship. I'm just afraid, of the talk that I hear that, you get one or two people that are a little bit not stable, and we could have some real problems. And that is a concern. I mean, especially when I talk to people about the fact they've let out some of these inmates and felons. These guys aren't going to ask questions. I mean, and it sounds, like I'm blowing smoke, but I know these people, and they're not going to ask questions if somebody comes on their property. And then again, you heard it before. We had another suicide last night, a 54-year-old male. And I mean, it's just nothing. It's nothing to joke about. It's just, I have a fear if we don't start doing a little bit more. So that's it. Thank you.
No, I appreciate that. And we don't have Benton County on this call, but I read an article the other day about the number of suicides that are up in Benton County is fairly substantial. And of course, there's the causation correlation question, but just the number itself is certainly concerning. So the mental health impacts are very real, and it's something that we need to make sure we're paying attention to as we move forward as well, and not lose sight of it right now too. I mean, I don't mind staying home so much, but other people, it's a real hardship on. So we need to be thinking about that, and it's a great point. Anything else before we say goodbye? Well, thank you all so very much. I know you're all swamped. We have been so much busier than we ever thought we would be during this time of year. And so we really do appreciate the time that you were willing to take out of your schedules. And legislators, staff, commissioners, please don't hesitate to reach out to WASAC if you need anything. Sometimes we are better able to get clarification on issues. Sometimes we're falling into the same problems that you're having in terms of asking the question a few times before we get an answer. But if there are ways we can be helpful, please don't hesitate to reach out to us, because it's absolutely what we're here for. So thank you to everybody, and we appreciate your time. Have a great day.